Good day, dear student. Today, the practical lab is about gram-positive bacteria, Staphylococcus species. This lab is very important because staphylococci are the common bacteria in hospital and frequently isolated from skin, wounds, blood, and urine sample. And by the end of this lab, we should know how to identify the Staphylococcus under the microscope and differentiate between the species of the staph as Staphylococcus aureus, Staphylococcus epidermidis, and Staphylococcus saprophyticus, and understand the culture media and biochemical tests used in diagnosis. Staphylococcus belong to the family of the Staphylococcaceae. So the genus is Staphylococcus and the family Staphylococcaceae, and is part of the normal flora of the skin and the mucous membrane. So it's normally live in our body, but it can be attacked as opportunistic pathogen, especially when the immunity is low or the skin is broken. And medically, there are three important species: Staphylococcus aureus, which is the most pathogenic one, and Staphylococcus epidermidis, which is opportunistic, and Staphylococcus saprophyticus, that cause the UTI infection, especially in a young female. Staphylococcus are important opportunistic pathogen, and it causes the pus-forming infection because Staphylococcus attract the neutrophil to the site of the infection, and when the neutrophil die, it forms the pus. Now, the species of the Staphylococcus, the most important clinically one is Staphylococcus aureus, which is the major human pathogen. It's a gram-positive cocci in a grape-like cluster and form a golden beta hemolytic colony, and it can cause the skin abscess, wound infection, and sepsis. And Staphylococcus epidermidis is a normal skin flora and low virulent, but it can cause the device-related infection because it's common in a catheter, prosthetic valves, and bacteremia. Staphylococcus saprophyticus is a normal vaginal flora, but in other side, it's a common cause of UTI, especially in a young sexually active women. It due to the colonization of the urogenital area and ascending infection into the urinary tract. Now in this slide, we will focus on the first step of identification of the staphylococci. As already the theory information I explained in a theory lecture. Now under the microscope, the staphylococci is a gram-positive cocci. It means it's a purple or blue color, and the arrangement is a regular grape-like cluster. The shape is cocci, but the arrangement irregular grape-like cluster typically, but sometimes may appear as a diplococci or tetrad group of 4 or short chain. The bacteria is non-motile. Staphylococcus is non-motile, it means they don't have flagellus structure, and non-spore forming bacteria. As I already explained the spore forming bacteria in a previous lab, it's a gram-positive bacilli bacteria, mainly Bacillus and Clostridium. However, the cocci gram-positive bacteria is non-forming the spore and usually non-capsulated. Although some virulent strain of the staphylococci may have a thin capsule, and the arrangement of the staphylococcus is a grape arrangement, it can differentiate from the streptococci, which is arranged like a chain. Culture characteristic, how it appears when they grow in a culture media, is facultative anaerobic. It means it can grow with or without oxygen and can tolerate a high salt concentration, 7 to 10% of sodium chloride. Why this is very important? Because it allows them to grow in a mannitol solid agar that contain high salt concentration. It can grow in a mannitol solid agar where the other bacteria cannot grow. and can grow in a different type of the media, including simple media such as nutrient agar, and the colony are soft, round, and creamy to yellow. And here you can see the colony of the staphylococci on a nutrient agar. The Staphylococcus aureus form the golden yellow colony because it produces the pigment. Epidermidis, they are non-pigmented and produce white colony, and Saprophyticus, a very low pigment, usually form the lemon white or creamy colony. The colony color is helpful but not definitive. It means more tests are needed to identify the species, such as the coagulistes that differentiate Staphylococcus aureus positive coagules from other Staphylococcus species, and Novobyzantes that differentiate between Saprophyticus and Epidermidis. On blood agar, Staph aureus produce the beta hemolysis. There are three types of the hemolysis: alpha, beta, and gamma. Staph aureus produce the beta hemolysis and produce the clear zone colony, and Staph epidermidis and saprophyticus, they are non-hemolysis. It means they don't have the hemolysin enzyme, while Staph aureus have the hemolysin that destroys the RBC on blood agar and produce the beta hemolysis, and the beta hemolysis indicate the virulence pathogenicity of the Staph aureus. In this image, you can see the beta hemolysis colony of the Staphylococcus aureus, which is indicated by the clear zone around the colony. While, as I mentioned, Saprophyticus and Epidermidis, they are not produce the hemolysis on blood agar because they don't have the hemolysin enzyme. The selective and differential media for staphylococci is a mannitol solid agar. This media is important because it's selective for Staphylococcus species, as only Staph species can grow on this media. It contains a high salt concentration, and Staph species can tolerate this high salt concentration, 7 to 10% of sodium chloride, while other bacteria cannot tolerate this high salt concentration in this media and cannot grow in this type of media. Why it is differential for Staphylococcus? It according to the mannitol fermentation. It contains the mannitol sugar, the bacteria that ferment the mannitol as Staph aureus change the color of the indicator and produce the yellow colony, while the epidermidis and saprophyticus are non-mannitol fermentation and no change the color of the indicator and produce the pink colony. As you can see here in this slide, the both species of the Staph aureus can grow on a mannitol solid agar. It means it's selective for Staphylococcus species, but one produces the yellow colony due to the mannitol fermentation, while saprophytics and epidermidis produce the pink colony because they are non-mannitol fermented bacteria. After the microscopic examination and the culture characteristic, the biochemical test should be done, and this test is very important, as I already showed you the video about the procedure of this test in a previous lab. But this test is very important, as all species of the Staph have the catalyst test. We can differentiate between Staphylococci from Streptococci because Streptococci don't have the catalyst enzyme, so we can differentiate between Staphylococci from the Streptococci by doing the catalyst test using the hydrogen peroxide reagent. And the bubbles formation indicate the positive catalyst, while the non-bubbles indicate the negative coagulase. After that, if the catalyst is positive, which is indicated by the bubbles formation and indicate Staphylococcus species, we can differentiate between the Staph species by doing the coagulase test. So catalyst differentiate between Staph and Strep, while the coagulase differentiate between Staph species. After the catalyst positive, we're doing the coagulase test. we can differentiate Staph aureus from other Staphylococcus species such as Epidermidis and Saprophytics because Staph aureus have the coagulase enzyme that convert the fibrinogen in plasma into the fibrin and form the clot. And we can do this test by slide method and tube method. And the positive result it indicates by the clot formation, which is indicate the Staphylococcus aureus. Now, after the coagulase negative result, because the positive result it indicates Staph aureus, while the negative result it may be Saprophyticus or Epidermidis. So we can differentiate between Saprophyticus and Epidermidis, the two coagulase negative species of the Staphylococci, using the novobiosine sensitivity test, as Epidermidis is sensitive to the novobiosine antibiotic test, while Saprophyticus is resistant to the novobiosine antibiotic test. And this antibiotic it used in vitro. It means it used for identification of the bacteria in lab. The procedure of this test it prepares the bacteria suspicion 0.5 according to the McFarland standard and spread the suspicion on agar, then put the novobiosine disc and incubate it at 37 for 24 hours. After incubation, we observe the result. If the zone of the inhibition around the disc is more or equal to the 16 millimeter, it indicates the sensitivity of the bacteria to this antibiotic, which indicate Staphylococcus epidermidis. While if there are no zone of the inhibition around the disc or the zone, they are less than 250 or equal to the 15 millimeter, it indicates the resistance of the bacteria to this antibiotic. It means the bacteria have resistance against this antibiotic because there are no inhibition zone. The growth it appears around the disc in a resistant bacteria, while in a sensitive bacteria there are no growth around the disc. And in this table we can differentiate between the three medically important Staphylococcus species, Staph aureus, Epidermidis, and Saprophyticus. All are gram-positive bacteria and cocci bacteria, while Staph aureus on blood agar produce the beta hemolysis, while Epidermis and Saprophyticus, they are non-hemolysis on blood agar because they don't have the hemolysin enzyme, while Staph aureus have the hemolysin enzyme, which is indicate the virulence factor of the Staph aureus. And on mannitol, Staph aureus, they can ferment the mannitol and produce the yellow colony, while other they don't ferment the mannitol on a mannitol solid agar. And the three species have the catalase enzyme. It means all species of the Staph or of the Staphylococci have the catalase enzyme, and we can differentiate between Staph and Strep by doing the catalase enzyme. While the Staph aureus only have the coagulase enzyme, while other Staphylococci they don't have the coagulase enzyme. So we can differentiate the Staph aureus from other Staphylococcus species by doing the coagulase test, as only Staph aureus have coagulase enzyme that convert the fibrinogen into the fibrin and lead to the clot formation. Another test, the DNase. Also, Staph aureus only have the DNase enzyme, while other Staphylococci they don't have the DNase. And if the coagulase is negative, we can differentiate between the two negative Staphylococcus, Epidermidis and Saprophyticus, by novobiosine sensitivity test, as Epidermidis is sensitive to the novobiosine, while Saprophyticus is resistant to the novobiosine. And that's all about the species of the Staph. Now, in this chart, you can show the step-by-step bacteria identification in a lab. The first step is always a gram stain if the bacteria is gram-positive or negative. Then, if the bacteria is gram-positive, we observe the morphology of the bacteria. If it's cocci under microscope, it means it's spherical shape or it's bacilli. If it is bacilli, we divide it in a two group, bacteria forming spore and non-forming spore. The bacteria forming spore, such as Bacillus and Clostridium, can identify by the spore stain and can differentiate it from other Bacillus gram-positive that are non-spore forming bacteria. While if the bacteria it appear spherical under microscope, it means it's cocci. There are two major groups of the cocci gram-positive bacteria, Staphylococcus and Streptococcus. We can differentiate between the gram-positive cocci bacteria by doing the catalase test, because all species of the Staphylococcus have the catalase enzyme, while other cocci gram-positive bacteria such as Streptococcus and Enterococci, they don't have the catalase enzyme. So we can differentiate it between the gram-positive cocci bacteria by doing the catalase test, as Staphylococcus is catalase positive, as indicated by the bubbles formation. If the catalase is positive, we can differentiate between Staphylococcus species using coagulase test, because Staph aureus have coagulase enzyme and it is coagulase positive, which is indicated by the clot formation, while other Staphylococci, they don't have the coagulase enzyme, such as epidermidis and saprophyticus. Then, if the result of the coagulase is negative, it means they are non-clot formation. We can differentiate between epidermidis and saprophytics by doing the novobiosine sensitivity test, as epidermidis is sensitive to the novobiosine, while saprophyticus is resistant to the novobiosine. And thank you, and that's all about this lab. If you have any question, I can explain them to you in a lab class.